Hello, I am Dr. Aizaz from medicovisual.com, back with another visual lecture on the topic of concept of epitopes and serological types of hepatitis B virus. In previous lecture we have discussed the structure of hepatitis B virus, and in structure we have studied that there were surface antigens, right? There were surface antigens in the envelope of hepatitis B virus. Now let's suppose this is a surface antigen and I am gonna enlarge it. Now because it is an antigen, by definition antigen means antibody generator, antibody generator. So because it is s-antigen, it means it can lead to generation of antibodies against itself. So it is an antigen. Now when antibodies are produced against this s-antigen, these relatively small antibodies cannot bind with this huge protein as a whole, right? These antibodies will bind with a small part or small pieces of antigen. Let's suppose this antibody, it may bind here, right? Or it may bind here, or it may bind here, right? It cannot bind this whole antigen. And the part or piece of antigen to which the antibody binds is called epitope. So what is epitope? Epitope is the part or piece of antigen which antibody recognize and binds to, right? This is the definition of epitope. Now based on the epitope, there are several different epitopes in surface antigen or s-antigen of hepatitis B virus, right? This one epitope I have shown here, this one, A epitope, right? Of course there is another epitope here and then another epitope here as well. A epitope is universal. It is present in all varieties, or you can say all serological subtypes of hepatitis B virus. But this antigen, nose epitope, that's what I like to call it. Actually it is not nose epitope. And this lips epitope, it has two variations, right? So the here epitope can be either this variety or this variety, and here epitope can also be either of this type or of this type. So two variations can be there, right? So let's create our antigen by using these epitopes. So for here this nose part or nose epitope, which nose should I use? This one or this one? This one? Okay, this one. So I am using this one. And for lips, okay, let's use this one for lips. So now we have created a complete antigen with 3 epitopes. And what are those epitopes? Yes, this A is already there, so A, and this one is D epitope, AD, and this is what? ADR. So now this antigen, now this serological type of antigen is called ADR antigen, ADR surface antigen, right? And hepatitis B virus, which has this type of surface antigen, we like to call that hepatitis B virus as ADR serological subtype of hepatitis B virus, right? It's very easy to understand. Let's create another serological subtype for practice. Now this time which one should we use? Okay, let's use this nose. This is not nose, remember. This is epitope. So this epitope, and now let's use this one, right? Should we use this or this? Okay, let's use this. Now what is the serological type should be named? It is A is already there, A is always there, and this is inverted Y nose I have shown, so it is AY, and here is W, AYW serological subtype, right? So in this way, by using these different combinations, we can have 4 serological subtypes of hepatitis B virus. What is this? AYR, this is AYW, right? This is ADR, and this is ADW. In this way, we have 4 serological subtypes. Now, what is the significance of serological subtypes? First of all, my question is that let's suppose, God forbid, a person gets infected with this type, this serological subtype, AYR subtype of hepatitis B virus, and fortunately he recovers from this infection, right? He is able to clear this infection. But my question is, now let's suppose in his blood, let's suppose this serological subtype enters into this blood. Will his antibodies that are produced in his body, will they be able to offer cross resistance or not, or cross protection against the new strain or not? Yes, they can offer cross protection. The reason is that this A is universally present. So even if the nose and lips may be different of the new strain, nose or lips may be different, but the antibody will still recognize from this part, and this antibody will catch this and it will kill this virus, and in this way it can offer cross protection or cross resistance. But then what is the significance of this subtypes? Why do we classify it in serological subtypes? Well, it is of epidemiological importance. What do I mean by epidemiological importance? It means that, let's suppose in America, usually the virus may be present of this serological subtype. For example, in India or Pakistan, this serological subtype may be more prevalent, or this serological subtype may be more prevalent in let's say Japan. So it is of epidemiological importance. Clinical significance is not that relevant, right? Even the vaccines, they can also provide cross protection, and reason I have mentioned, right? So this was about the concept of epitope and serological subtypes of hepatitis B virus. Thank you so much for watching this visual lecture. Please like this video, please subscribe to my channel and press the bell icon. Also, please join my Facebook group.